Hello, I'm Dr. Warren Bruhl, and I'm going to be specifically talking to you today about the instrument that we use to adjust the spine that involves using a non-cracking technique, what I like to refer to as a gentle non-cracking approach to chiropractic. Sometimes people are a little afraid of chiropractic because they're afraid of that popping sound or that cracking sound, and while that's perfectly safe to have those types of adjustments, sometimes it's a little bit frightening, so someone might be nervous or apprehensive to seek out chiropractic treatment. But there are modalities that are now available to use that are very effective in adjusting the spine and don't involve any cracking or popping at all. And one of those instruments that we use is called an impulse instrument. While it looks a little bit like a handgun, it's primarily an instrument that is delivering a very specific mechanical force to the spine. There are three different heads that are used on it depending on what we want to accomplish. Head number one is just a stylus head that looks like this. Head number two is a dual stylus head that's a little bit wider for the lower part of the spine. And head number three has a dual stylus as well. It's a little bit narrower, and it's used in the thoracic spine and the cervical spine. So when we're going to use the impulse instrument, there are three different settings to be used, and the strongest setting is usually used on the lumbar spine and the sacrum, the lower part of the back, because the area down here has a lot thicker tissue and muscle tone. So the instrument is resting on the spine, and then the trigger is pulled just like that, and it gives a repetitive motion back and forth. Now that repetitive motion has been shown in research to be able to relax the muscles most effectively and move the spine. The spinal joints have receptors called mechanoreceptors that respond most effectively to that specific movement. And so we'll apply it to the joints that are subluxated and make those movements on a repeated basis. As I move into the thoracic spine, I'll change the heads, change the setting, and it's a little lower setting as the adjustments are being made. And for the cervical spine, we'll go down a little bit lower and make the adjustment. And so that is the use of the impulse instrument. The impulse instrument, once again, is a gentle, non-cracking approach to chiropractic care. Very safe, very effective for people of all ages, children, older people, people in their middle years as well. And we find we get great results with this particular technique for our patients.